So if you were to consider Panchavalkala versus Triphala, for example, external application, do you see both of them acting in a similar way, or there are some specific conditions in which one is better than the other?
Panchavalkala versus Triphala. One important thing we need to understand is when we are putting them as a dusting powder, something like that. Our powder or the Panchavalkala or maybe Triphala, it should be very, very, very fine. Something like 120 mesh pass it through. Such type of very fine powder it should be. Otherwise, because it's Panchavalkala is all the material is from the bark basically, so it will be more fibrous in nature. So then actually if we don't make it very fine powder, then putting a little bit rough powder may, instead of causing an positive thing out of this treatment, may even become a counterproductive, causes a damage, or it becomes in the way of healing. So that needs to be taken care of. When these things are applied in the form of ointment, okay, it is an entirely different issue. Then there will be no such problems that can be done. But wherever any wound or a sore, if it is oozing continuously and it is not healing, then the drug of choice for my concern is that will be towards Panchavalkala, because Panchavalkala is more dominant because of its potent kashaya rasa when compared to Triphala. Triphala is very good for eye wash or buccal cavity for the gargle or wash. But when it comes to external wounds like diabetic foot ulcer or bed sore and all those things, Triphala is next choice. The first choice should be or would be Panchavalkala, because Panchavalkala has a better capacity to nullify the oozing or reduce the oozing, and once oozing reduces, automatically healing takes fast. So Panchavalkala is a better choice in those conditions.
We can also consider Triphala as a poor man's Panchavalkala. Like many people tell that Panchavalkala is not easily available for us. We have searched a lot. So Triphala is easily available, like just like Godambi and Kadlakai. So in Kannada we tell, no? So poor man's this cashew nut is the groundnut. So just like that, non-availability of Panchavalkala. So many times I have asked the patient to use Triphala is available, sir. Okay, use it for time being as you search or till we make it available to you. So that can be used as a handy one. Triphala is available everywhere. So once Panchavalkala is available, as Gururaja sir said, in complicated conditions, even in the infected conditions, and when there is oozing, things not responding to other medications, Panchavalkala is the best which can be used in the clinical practice.